I'm Zahirah Haniyyah from International Class Subject Entrepreneurship. From the Medical Surgical Nursing course, I am to learn and understand more about the endocrine system, especially the disease diabetes mellitus. There are several questions that spark my curiosity, such as first, what is the role of the endocrine system, especially the hormone insulin, in regulating blood glucose levels in the body? Second, what happens to the endocrine system when someone has diabetes mellitus? Third, what are the differences in hormonal disorders between type 1 and type 2 diabetes mellitus? And then next, why can dysfunction of the pancreas as an endocrine gland cause systemic complications in diabetic patients? And then last, how can nursing interventions help manage endocrine disorders in patients with diabetes mellitus? Among this question, I choose to discuss question number 2. What happens to endocrine system when someone has diabetes mellitus? I will also present solution related to these issues. Diabetes mellitus is one of the disorders of the endocrine system that involves an imbalance in the hormone insulin. Insulin is a hormone produced by the beta cells in pancreas and functions to regulate blood glucose levels by helping glucose enter the body cells as a source of energy. In patients with type 1 diabetes mellitus, the immune system attacks and destroys the pancreatic beta cells, resulting in a complete stop of insulin production. As a result, glucose cannot enter the cells and accumulates in the bloodstream. In contrast, in type 2 diabetes mellitus, the body still produces insulin, but it cannot be used effectively, a condition known in insulin resistance. Both types lead to elevated blood sugar levels, which is uncontrolled for a long time, may result in serious complications such as damage to blood vessels, kidneys, eyes, nerves, and the heart. Therefore, disruption of the endocrine system, particularly insulin hormone function, plays a central role in the development of diabetes mellitus. Solution for managing endocrine disorders in diabetes mellitus: first, medical therapy based on diabetes types. Type 1 diabetes. Since the body does not produce insulin at all, patients need to receive regular insulin injection for life. Type 2 diabetes, typically managed with lifestyle changes, oral medication such as metformin and or insulin is necessary. Second, balanced diet for nutritional therapy. Regulate the intake of carbohydrate, sugar, and fats. And then third, regular physical activity. Exercise increases insulin sensitivity and lowers blood glucose levels. And then next, routine blood glucose monitoring. Patients should regularly check their blood sugar levels either independently or with healthcare support. And the last, education and psychological support. Patients should be educated about their condition, self-care routines, and the importance of medication adherence. This video based on journal reference Satyawan MA and Satyawati 2021. Thank you so much for your attention and bye-bye.